Welcome to my family companion episode 6. Today we are discussing sex during pregnancy. It's one of the sweetest topics I love to discuss with couples in the family clinic, and today I'll be sharing a lot of insightful stuff with you. We're going to look into safe sex in pregnancy, all right? Because sex can be unsafe in certain conditions in pregnancy, all right? We're also going to look into how pregnancy affects the desire for sex in women, all right? I'm also going to show us a lot that will clear the doubts and the fears that couples have about how sex may affect their baby in pregnancy, okay? Then we're also going to look into comfortable sex positions for couples during pregnancy, and we're going to look into the health and social benefits of sex during pregnancy, okay? And finally, we'll discuss when to be cautious or to even completely avoid sex as a pregnant couple. All right, so if you invited people to be on this conversation, go ahead to invite them to join right now if they haven't joined. We're also going to look into pain, or what you call contractions after certain sex, all right? Especially from around 28 weeks upwards, some people may have some contractions after they have sex. And again, very importantly, I'm going to give you 4 key signs you have to watch out for, that if you experience them during or after sex as a pregnant person, then something is clearly wrong and you need to see your doctor. Okay, so while you invite everyone, I want to see where you are joining in from in the comment section. Let me know your name and your location, wherever it is you are joining from across the world. And as we do that, I want to first and foremost appreciate the Medical Women's Association of Nigeria, who are official partners with my family companion for this health advocacy that we are doing for families across Nigeria, Africa, and the wider world. All right. As you know, in all our series, we start by reading the story that inspired that particular chapter, and then we go into the discussions properly. And today we're taking a story from a man called Gentle. Okay, don't forget, if there are people you invited to be on the call, this is the time to reach out to them so that everyone joins and then we kick off together at the same time. And this month, on the 30th of September, we are going to be launching this book at last, My Family Companion. And I'll use this moment to just talk briefly about it while you invite everyone who is supposed to be on this call. I wrote this book, and I think it's one of the most difficult tasks I've engaged in the recent decade, all right? And that's because of how I thought it would be and how it ended up becoming, all right? I had to cover over 340 research publications for us to have the accuracy that is in this material. And everything is directly communicated in a first-person language, as though I am talking to just you as a person, not just speaking to a random reader or an audience. It's written speaking to just one person, one couple, one woman, one man. And each chapter is inspired or starts with a real story of a real patient who had either a negative or a positive outcome that brings to life the need for that topic to be taught. Okay, so I look forward to sharing with you. The website will be launched on the 29th, and then the announcement will be made. And what else? It will also be available on Amazon, so that those who are outside Nigeria will also be able to access it. And it's the best gifts you could give to any married couple, especially if they are not medical professionals. A whole lot of value. So we're in chapter 6, and if you are joining us for the first time, we've done the first episode, second, third, fourth, fifth, and this is sixth, and each one builds on the other. And today we're looking into sex in a pregnant family. So let's start by reading the story of Gentle. The story we have here. Of course, the name is the story is anonymized just to cover the identity of the couple, but the story is maintained clearly clinically so that the insights will be communicated to anyone who shares or listens to it. So let's read. Gentle story. Okay, so I felt alone and unwanted. When Glory got pregnant the first time, I was excited. I mean, yes, I was a bit scared too. We're going to be parents. But I also assumed life would stay mostly the same, especially in the bedroom. But one night, I leaned in and she just went cold. The same thing happened the next time and the next. She didn't say anything, but I could tell she didn't want me. What I didn't understand was why. Her belly was still small. It wasn't like I was hurting her or anything. I started to feel rejected, honestly. I even asked myself if maybe I had done something wrong, or if I wasn't really satisfying her in bed. We didn't talk about it, and I didn't push it, but it created a space between us, an emotional space. I started holding back too. We were both just coexisting, waiting for the baby to come. But this second pregnancy, we sat down early and said we can't do a repeat of last time. So we decided to talk. No hiding, no assuming, just honest talk. It made a huge difference. I started to understand what she was feeling. She explained how her mood was always all over the place, how her body felt strange, how sometimes she was just too tired to even think about intimacy. And me, I got to express myself too. I told her I missed feeling connected, that sometimes a kiss or a cuddle meant more than the act itself. Now we talk, we adjust. Some days it's hot, other days it's hugs and foot rubs. I see what you did there, guy. Okay, but through it all, we're close, and I finally understand what she needs and how I can still be a part of her world even if things are different. Don't get me wrong, we do have sex, lots of it, and we are learning new ways all the time. Pregnancy changed her body, but this time it didn't break our bond. Amazing. And this is the story of a couple that went through their first pregnancy and it almost caused friction in their relationship. And we see that a lot in practice. A woman will tell you, I think my husband is cheating. Since I got pregnant, I've noticed his moves have not been the same. And I sense he's going out with some people and all those kind of stuff. And the truth is that that happens in many relationships. That happens in many marriages, especially when the woman gets pregnant. And that's somehow related to the fact that it has been said that sex is a need for a man. And when they say it's a need, it's something he needs to function sometimes. So when it's not coming in marriage, most people who don't have the discipline begins to find other ways as a coping mechanism. And they do those hiding it from their wives, but sometimes those things break the marriage and create conflict. And that is why the topic of sex in marriage is a very, very, very important one. Okay, so having said that, let's get straight into the conversation. Okay, so I know you have a lot of questions in your mind. Feel free at the end of this conversation. We'll have most of the conversations in the chat room here in the video, or also we'll have our community where we'll have further conversations and people get to ask me questions 2, 4, but not 7. All right, because I have to take a break. Okay, so either ways, let's be active and let's learn. If anything I say resonates with you, just do some energy emoji. I want the conversation in the chat room to be hyper in this particular episode. So let's talk about sex in pregnancy. So yes, for most women, sex during pregnancy is perfectly safe. And not just safe, it can even be enjoyable and beneficial medically. So beyond the physical health or emotional connection and all of that, one of the things sex does in pregnancy is that it keeps the feeling of being desired alive between a couple. Because when a woman gets into pregnancy, her body changes. You may see someone who was once slim queen before become so fat and so chubby. And if you're someone who put a lot of emphasis on how you look, your confidence may begin to shake. And if your husband is also not coming after you sexually, physically, you may also begin to feel that you've lost your essence or something about you. So beyond those health benefits or the emotional connection, sex between couples and the man consistently going after the wife also creates a sense of security, right? And a feeling of being loved and desired in the woman. So it is a very beautiful thing in marriages and helps couples to stay close and stay connected for the 9 months period that they experience the baby coming. Okay, we're also going to talk a little about sex after pregnancy. All right, if a woman is done delivering, we'll look into it just briefly. I just hope I don't forget that. So if I do, no, I won't forget that. Okay, let me just note that down so I don't forget it. All right, because it wasn't something I wanted to talk about today. So let's get to it. So how safe is it to have sex while a person is pregnant? This is the key thing, all right? Everything I'm teaching, I'm trying to follow the outline I have here so that I don't miss any points. The first is for you to realize that if your doctor has not warned you about sex in pregnancy, then sex is generally safe for you. And by the time we're done talking, you will see the things that if they are present already, your doctor would have talked to both you and your partner about sex in pregnancy. Now, sex doesn't hurt your baby when you're pregnant. The baby is well protected by a lot of mechanisms. The first is the amniotic sac, which is the room where the baby is within the womb, sealed with the amniotic fluid that cushions any pounding effect of sex. The baby doesn't receive the trouble of losing your trust that happens during sex. All right. Number two is that there's something called the mucus plug, that when a woman, inside the woman's body, into the vagina, you now meet the cervix, and then when you pass the cervix, you get into the womb. Now, that cervix, which is the junction between the vagina and the womb, that junction point, there's a plug, which we talked about last week, called mucus plug. So it seals that place off to make sure that nothing comes out and nothing goes in. So that also gives a lot of protection to your baby from basic infections and also from anything at all. Like, it's difficult for the phallus or the man's this thing to get into the place. Then number three is that we have the uterus itself being the womb with very strong muscles that protect the place where the baby is staying. All right, the external layers of the womb is actually thick muscles that are very strong, that protects the baby from most of the impactful activities that happen during sex. Okay, so that keeps you with a kind of a rested mind, so you don't have to worry about, is sex affecting my baby negatively? Rather, it's even affecting your baby positively, and we're going to talk about that. So let's look into how pregnancy affects libido, or the urge or the desire for sex throughout pregnancy. Like we discussed last week, is it last week? The most difficult period for a woman is actually the first trimester, because that's when she is adjusting to this new experience. So even though her stomach or her abdomen is not yet so protruded, which is what some men are wondering, why is she not allowing us to have sex? It's not like I'm hurting her, just like in the case of Gentle and Glory. It's not like I'm doing her anyhow. Why? But they don't understand it. So men, this is when you need to understand this, and this is what you tell them. At this period, there are a lot of new hormones that were not present a couple of weeks or months before that time. And those hormones just makes the woman's emotions to just be here and there. But not just that. It also makes the woman feel nauseous, the morning sickness we talked about. Or sometimes it can also make the woman feel so exhausted and so tired. So all of those adjustments in the first trimester, the first 12 weeks, makes it that the woman may not all women, but some women, and not just some women, most women may not be comfortable to engage in sex within that period. Or if they do, not as frequent as they would normally have sex with their partners. All right. So during that period, there are many other ways to ensure that affection and closeness is maintained. Cuddles, wrapping yourself together in the bed, holding hands, touching, conversations, spending time together, watching movie, lying on her leg, she lying on your leg, putting her head on your chest. All those kind of romantic appeals may keep the relationship bonded and not necessarily to have the intimacy that comes from penetration in sex. All right. And when you do that, you even realize that you'll be able to rewire the emotional state you have, both as for the woman, and then the man helps the woman also, right? And sex can actually happen smoothly and sweetly during that period. Because like it is said, I'm not a relationship expert, but as it is said, sex is first a thing of the mind for a woman before it is a thing of the body. So if she feels loved, nurtured, taken care of, then sex will almost happen naturally and it will be a sweet experience for her. I don't think there's any man who wants to have sex with a wife or the partner and she's not enjoying it, and he will be enjoying it. The intimacy that comes from sex is that one feels happy seeing that he is giving or she is giving pleasure to their partner. So, and this is what a man can help a woman to achieve in the first trimester when the urge for sex is not there. Then the second trimester, this for nearly 99% of women is the sweet spot for sex. In fact, they almost wish that period can be present for the rest of their life. And this is the reason. Now, as the pregnancy begins to progress from the 13th week upward, there is an increased blood flow to the pelvis. And let me just move out a little. What do you call erection? When a man wants to meet with a wife and then he gets erected, right, or achieves erection, what actually happens is that blood flows massively to the man's pelvis and to his reproductive organ, and suddenly what was little grows to become big, and that is erection. So simply it is blood redirection from the brain or the digestive system or for the most part of the body, and then go concentrated to the male sexual organ. In the same way, when a woman is in the second trimester, there's a lot of blood flow going down to the pelvis because there's need for a lot of things over there. That's how the baby begins to now get nourished. That's how the woman's pelvis begins to prepare for everything about pregnancy. So within this period, the woman's desire for sex is very much. So she's able to enjoy the experience. She's able to, she wants it again and again and again. And a man will wonder, like, what happened? And then suddenly you've changed. This is what is happening. All right. In addition to this, all those hormones that were making the woman fluffy in those first trimester have gradually balanced off, and the woman is now in full grip of her emotions alongside the physiological process of blood flow that is causing her urge for sex to be elevated. So this is why most women would love to have a lot of sex in the second trimester. And finally, in the third trimester, which is now when the belly has become so big, all right, and the back aches begins to kick in. At this point, sex may not completely be very appealing as it used to be. Some women still enjoy it anyway, and others would prefer to wait. It all depends on how you feel. You just need to listen to your body and talk to your partner. All right. And this is also particularly where sex position becomes very important. So let's talk about it. As your body begins to change through all of those trimesters, there's need for you to also begin to change your approach. And the goal is to be comfortable during sex. And most times, your sex position is what makes all this to be possible. Now, if you are not married, I want you to close your left ear so you just hear this thing with just one ear. So you use it for when you need it. Okay, so what are the comfortable sex positions for a couple that is pregnant or that are pregnant? The first thing to bear in mind is the ultimate sex position is a position that allows the woman to be comfortable. Once she is comfortable, sex can progress for as long as you ordinarily would have sex as a couple. All right. And it's also important for the man in this period in pregnancy not to be in a hurry to step into penetration. There's need for the foreplays, the kisses, the touches, and all of that, just so the woman is already well stimulated, so that even if the penetration doesn't last for so long, she has that sex and she comes out of the experience satisfied. And that's very important. So after the foreplay, and when we do that, it's important to be very hygienic. Make sure you've had your bath, make sure you're clean, make sure you are not retaining urine. As a woman, your bladder in pregnancy is already compressed. It's a little, you can't hold a lot of urine. So make sure you empty your bladder before you get into sex and immediately after sex also. And if you are couples that use your hands have to be clean. That doesn't need to have to go and use methylated spirit to sterilize. You just wash your hands in running water and make sure you have clean hands for whatever you do as couples in pregnancy. Okay, then concerning the positioning, the first position recommended is side lying, or what is called spooning. The idea is to keep the pressure off the belly. So when the woman is lying by her side, which is already her lying position, the left lateral position where she lies on the left side. So at that position, she's not putting a lot of weight on her belly and she is relaxed, almost as though she's even sleeping, and the sex can happen comfortably for her. All right. Remember, our focus right now is comfort for the pregnant woman. All right. So the man should find his way to be active and engage in the whole process while the woman is having the maximum rest. Number two position is the woman on top. And this is very, very recommended, and not the man on top. Why this is important is because first, it takes the pressure off the belly like we talked already. But number two, it gives the woman control over the depth of penetration. All right, so that she allows penetration that she is comfortable with psychologically and physically, and also to allow the amount of pressure that she wants and not the pressure that comes from the man being on top. All right. The other position is the edge of the bed, where the woman is lying, where the wife is lying facing or lying over the bed, and then the man is coming from the behind. And this way also there's release of pressure on the abdomen, right, so that the woman is comfortable. In summary, is positions that allow the woman to be comfortable. That is what is recommended. And because of that, I want to emphatically stress that the woman should avoid lying on her back, especially from the 20th week. Remember, we talked about it last week. It puts pressure on the two big vessels at the back, right, of the posterior part of the abdomen internally, which brings blood from the leg and all the lower part of the body back to your heart, and from the heart straight to your lower extremities. All right. So when you put compression on that, it may, while the woman is in that position, there will be reduced blood flow. She may begin to feel dizzy, and it's not completely good for her or her of the baby that she's carrying in her womb. Okay, So let's look into the benefits of having sex during pregnancy. All right. So that this will encourage you to enjoy yourself each time you are pregnant. Number one is that pregnancy releases feel-good hormones, oxytocin, endorphins, and these things can lighten your mood, boost connections, and reduce stress. So it helps you generally emotionally to have sex when you're pregnant, because pregnancy on its own already is a stressful stuff. So anything that lights your mood, gives you a good experience, is a beautiful one. And these endorphins or these hormones can last for a long period of time and help you to, number two right now, enjoy a good sleep. Because sex will stretch your muscles and get you to relax, making it easy for you to have a sound sleep. So that is very beautiful, especially at night. Number three is that sex increases blood flow, increased circulation. So an increased circulation is good to supply fresh things to the baby and take out waste products from the baby. In the same way, it supplies things to you fast and also takes away fasting. So increased circulation, just make sure that you are well nourished, well hydrated, well taken care of by your blood system and circulatory system for the entire period of pregnancy. And this is another reason why sex is good in pregnancy. And remember, we talked about that during sex, there's a lot of blood flow to the pelvic region, and all of these things begins to prepare that part of your body for the eventual labor that will come once a woman hits her term. All right. The fourth benefit is that it can also help to relieve pain. All right. So the hormones released during orgasm can also help to ease minor pains. All right. So which is also why some people like when they're done having sex, they'll tell you that the pains just seem to have gone away when they're pregnant. So this is why it happens. All right. The fifth benefit is also because pregnancy, or rather the semen from the man contains prostaglandins. Is a hormones, and it's a hormone, and this hormone softens the cervix. Remember, I told you the junction between the vagina and the uterus, being the womb, is the cervix, and it's usually closed and plugged by the mucus, which seals it off from the external environment. Now, the prostaglandins present in the semen of the man helps to soften the cervix, and this becomes very useful towards delivery to help for the cervix to dilate properly and for delivery to happen easily. So this is also one of the benefits of sex in pregnancy. So the warm up and the preparation begins early on as your cervix begins to prepare for the D-Day. So don't worry, when we say it softens the cervix, it doesn't mean it will open the cervix unless it's actually the right time. Okay, so those are the benefits. Let's now look into when do you need to be careful, cautious about sex as a pregnant person. All right, so there are a couple of circumstances that once they're present, your doctor may advise you to stay away from sex or to minimize sex. Number one is if you've had a history of unexplained miscarriage, where a couple lost their baby, but they can't say exactly what it was that caused it, and the hospital was not able to pin it to a specific thing. So we'll just tell you, in your next pregnancy, just be careful about sex, especially let the woman always be on top to control the depth and also the pressure. All right. If you have preterm labor in the past, where you got into labor before time, remember I told you sex also begins to prepare you for delivery, because there are two things that really happen. I didn't mention the second one, which is Braxton-Hicks contractions. After sex, some women may begin to have contractions. All right. For some women, that may trigger a preterm labor, or sex itself may even trigger a preterm labor. For women where this thing don't happen, sex will not initiate it. All All right, preterm labor is a different conversation on its own, but this is just one of the few things we'll become careful about. If a woman has had it in the past, then we'll tell them be a little careful about how you engage with sex. All right. Number 3 is if a woman is pregnant but is having spotting or bleeding, vaginal bleeding. All right. This is where people tell you, can a pregnant woman be seeing her period? That was not period. She's bleeding and the pregnancy is under threat. So when a woman has bleeding in pregnancy, some people may have bleeding throughout their pregnancy and they'll still successfully carry out the pregnancy. It may just be the position of the placenta that is, let me not go into details that will just bore you. But yes, if a couple is having bleeding while they're pregnant, then we'll tell them to just stay away from sex completely while we see how this thing evolves, alongside other remedies we may do for those couples in the hospital. Number 4 is if a woman is leaking fluid. This time around is not blood, there's leakage of fluid. All right. There are certain things we do, but in addition to that, we also tell them be a little careful about sex, stay away from it for a time being. All right. Number 5 is if there is a presence of sexually transmittable diseases like HIV, like cytomegalovirus, like hepatitis, all those illnesses that are very infectious, will tell you just hold off, let's manage the pregnancy to delivery, and then we see other things we can initiate. Okay, this is both in the man and in the woman. If the woman is HIV positive or have any of these infections present and she's pregnant, we'll tell her to just hold on, not engage actively in sex until she delivers, and then we'll look into all the other details. Okay. Number 6, your doctor may also tell you to stay away from sex if you have been diagnosed with what we call weak cervix. That's a simple language, we'll call it cervical incompetence. In some women, remember I told you this is the vagina, right? And then when you go in, you meet the cervix, and then when the cervix opens, you meet the womb. So the cervix is the junction that seals the womb off from the vaginal vulva downwards. Okay. So if there's an incompetence where it is not very tightly holding, okay, then we usually do what we call cerclage, where we suture the cervix to keep it tight so that it doesn't open and the content of pregnancy moves out. All right, we'll keep it intact by putting a cerclage. So if a woman has incompetent cervix or a cervical incompetence or a weak cervix, like I've explained, then we always advise them to just stay away from sex, because the intrusion of sex during penetration will impact on those things and may compromise the pregnancy. Number 7 is if a woman has been diagnosed with placenta previa. This is a condition where the placenta, instead of being in the right position, is positioned anywhere else that may make pregnancy difficult. For instance, if it is lying in the lower part of the womb. So this is the womb, all right? And then the cervix is somewhere here. Remember, this is the opening downwards where the baby comes out. And the placenta is lying over here or lying by the side here. Okay, those positionings make it that the woman may start having bleeding or have other issues that may make the pregnancy very difficult. We even have what we call placenta abruptio, where the placenta pulls off even before a baby is delivered. All right, so those are issues that if we make those diagnoses, we'll make those diagnoses by ultrasound. If we make a scan and see where the placenta is positioned, then we'll tell a woman you have this, so let's be careful about that. So those are the conditions under which we tell you to be careful about sex. Now, let me talk to you about the contractions that happens after sex. We call it Braxton-Hicks contraction. We talked about it last week. We said that when a woman is stressed physically, it may trigger her to start having some contractions that is not really the labor contractions. Number 2, I'm wearing this stethoscope so you guys know this is a medical conversation. Number 2, it's if the woman is dehydrated, if she's not getting a lot of water, she's not drinking a lot of water, and she's dehydrated, it may trigger contractions that may also that will call Braxton-Hicks contraction. But number 3, when a woman has sex, sometimes it can trigger contractions that we also call Braxton-Hicks contractions. So what do you do about it? If that happens, get rested, drink a lot of water, and ultimately change your lying position. So if you were lying like this and it was still paining you, change your position to the other side. Oftentimes, just by switching your positions, Braxton-Hicks contraction may just go away. The word is may, all right? But oftentimes, most times, it goes away. So take water, get rested, change your position, get some sleep. If you wake up, it is gone. So if these contractions persist and becomes unbearable, you need to see your doctor, all right? Now let's look at important things to watch out for as a pregnant person during sex. When you see them, you need to go and see your doctor. Number 1 is painful intercourse. Sex is not supposed to be painful because you are pregnant. That's very important, because some people tell you why it's paining me is because I'm pregnant. No, sex is not supposed to be painful in pregnant. If you're having painful intercourse, you need to go and see your doctor. That's very important. Number 2, if you are bleeding after sex, all right, even if it is light bleeding, light blood dropping after sex, it is not normal. Don't say it's because I'm pregnant. No, you're not supposed to have bleeding during sex, after sex, as a pregnant woman. If you see that, you need to see your doctor immediately. Number 3, if after sex you begin to see leakage of fluid, or during sex you're having leakage of fluid, that could be your water breaking, all right? Don't think that is sweating or being sexually aroused. When you have leakage of water, I don't know how to explain it, all right? But yes, if after sex you are seeing leakage of fluid, it is not a good sign. And don't say it's because you're pregnant. Actually, something is going wrong and you need to go see your doctor immediately, all right? Because the amniotic fluid, which is what keeps your baby cushioned, protected, where it's dancing and swimming all over that place, you don't want that thing to go away, because that's what actually keeps the baby safe and protected, all right? So your water is not supposed to break at home. It's not even supposed to break during sex. If it ever breaks, the next place you should be is in the hospital, all right? And then number 4 is painful urination before, during, or after sex. This could be a sign of infection, and it is not good. So if you are having such experience or any of these experiences during pregnancy, it's not good, all right? The other part is, it's not something that happens during pregnancy, but if you notice that, yes, it's something that happens during pregnancy. If you notice that you are having discharge, thick whitish discharge during sex that has a smell, all right, or that is pasty during sex, or sometimes it could also be itchy, it is not a good sign. It is not because you are pregnant and infection is actually present, and you need to see your doctor immediately, all right? And I promised I was going to talk about sex after pregnancy, okay, because all I've discussed already are all the themes, all the key context or concepts that plays a role during pregnancy. So now, after delivery, for the next 6 weeks, a woman continues to bleed, and we call it lochia, all right? So the first one will be a little reddish, then it will switch to a little pinkish, then it will switch to a little yellowish, then suddenly it will stop. So during this period, it's not ideal to have sex. Coupled with the fact that the woman who just delivered also needs time for her reproductive tract to heal, especially if she received episiotomy. Episiotomy is the cut they give certain women if the head of the baby is a little big and is unable to come out. They need to make that cut for the baby to be able to come out, and then it is sutured back. We'll say that the vagina is a forgiving organ because when it heals, you even see those scars at all. All right. So if those things are present, you see that it's already not completely right to be having sex with those things present, because infection can set in and that becomes a problem. And if a woman had a cesarean section, she also needs to heal completely before she begins to have intercourse. So our recommendation is that a woman should allow the first 6 weeks to pass completely, and then she checks herself to be sure she wants it and she's in the mood, and they get started. And just like someone who was pregnant, those sex positions should also be maintained so that she controls the pressure, she controls the penetration, she controls the depth, and until they ease in to their pre-pregnancy state and begin to fire like they previously would do before they got pregnant. So those are the key issues to bear in mind for sex during pregnancy. It's not a lengthy conversation. It's a very smooth and a beautiful one. Next week, we're going to be looking into labor and safe deliveries. And it's one of the very, very critical issues. Last week, I got a message from someone who asked me to keep her story anonymous. She lost her baby, who she had carried safely to hospital for delivery. And in the hospital, for their careless behavior, the baby died. And this is why I always advise, don't go have your delivery in certain kind of places. One of the reasons why I don't recommend private hospitals is if you are going to a private hospital where you are not seeing a specialist obstetrician and gynecologist. I'm a doctor, but I am not an obstetrician and gynecologist. I'm not supposed to see you. I'm a doctor, but I'm not a cardiologist. I'm not supposed to see a person with heart problem. I'm a doctor. I'm not let's say a neurologist. If someone comes with anything that have to do with neurology, I'm not the specialist to see that person. I may receive this person, do basic things to stabilize the person, but I should quickly refer to the person to specialists that see such matters. I'm a doctor, and maybe I'm not an endocrinologist. I'm not supposed to be seeing a woman who has diabetes or a person who has other issues that have to do with endocrinology. We have specialties. So in private hospitals, sometimes, I'm not attacking any hospital or against anybody, but when you go to a hospital and you're not seeing a doctor and you're not seeing a specialist, you're just seeing any doctor, or you have no doctor on site to monitor you and chart your pregnancy properly, it's an unsafe place. The best places are places where you have a specialist who is attending to you. All right? And that's how she lost her baby. It's such, I read it. I was doing my evening workout and I froze. My prayer walk, and I got the call. Then after that, when I was walking back, and then I began to read my messages as I head back to my house, and I see this message, and I felt so bad, so troubled, so burdened. How can a woman have carried her pregnancy successfully only to lose it on the day of delivery? It's not supposed to happen. Pregnancy is not an illness. Babies are not supposed to die. Women are not supposed to die if the right things are done. And that's what we'll be looking into thoroughly next week on labor and safe deliveries. We're going to see the case of a very sophisticated family, a wealthy family that lost their baby to the myth of delivering like the Hebrew women. We're going to go into extensive conversations so that you don't fall victims to any of those things. I'm also going to tell you things to look out for when you give birth, to be sure your babies are not switched in certain kind of hospitals where we've heard stories of such things happening, and all the other nitty-gritties that makes delivery to be a smooth one. The first things that should happen in the first 24 hours after delivery to make sure your baby is in the right place. All the details will be discussed next week. It's going to be an amazing talk. For me, that's my heartbeat. All right, that's what I like to teach on the most. So we'll have a guest, or we may not have a guest, I'm not yet sure, but whatever be the case, I'm going to be speaking directly on that topic because I want to make sure I communicate it in my own way. I'm not the best teacher in the world, but when I'm passionate about things, I like to just pour it the way I want to do it so that the people I'm addressing will get the best value that I can give to them. All right, so we've come to the end of today's episode, and if you have questions, this is the time to begin to drop them in the comment section. And if you're not married, everything you learned right now, store them somewhere for when you need them. Don't go start trying out things. All right, and ultimately we'll have our community join and get ready for 30th of December for the book launch. Get active, get a copy. There's going to be free distribution nationwide. Once you buy your copy, we'll do the free delivery, rather free delivery, not free distribution, free delivery nationwide. And I'm also reaching out to all my mentors and all my respected elders in all the places I play, in ministry, in medicine, health, in business. All of them are also going to be on the live launch on my birthday, 30th. I'm going to be live, not a premiere, a live. I'll be here taking questions. I'll read it and then I'll answer any question you have about for me. On the 29th, I'm going to be releasing a video, an interview called The Story of My Life. And I'll be telling you all that has happened to me for the past, for as long as I've lived. But most importantly, the key things that have happened to me in the last 15 years. I've been a pastor for 15 years. I handed over for pastoral ministry in Easter of this year. And I'll tell you why I did that. A lot of people have been itching to know what happened. Nothing happened, but I'll just share the story with you on the next phase of what I want to do with my life, and then all the ways that we can partner together to make wonderful impact. If I've been a blessing to you, look forward to that day, be a part of it, and let's do great things together. All right. I don't know what to say, but if you've not watched all our previous episodes, go learn, watch. If you know families that are in need of these things that we are sharing, let them join our channel. If you've not subscribed, subscribe. And until I come your way next week, Sunday, 7 p.m., keep having an amazing life, and peace out. Don't forget, I won't wear this again in our video. All right, guys. All right.